Using antibiotics when they are not the right medicine will not help your child feel better. It can even be harmful. Antibiotics are medicines used to treat infections, and they target bacteria, not viruses. The providers at Children's Medical Group will evaluate your child and determine if antibiotics are an appropriate treatment. The American Academy of Pediatrics provides the following answers to common questions about bacterial and viral infections as they relate to pediatric patients. Colds are caused by viruses. Antibiotics are used specifically for infections caused by bacteria. In general, most common cold symptoms, such as runny nose, cough, and congestion, are mild, and your child will get better without using any medicines. In most cases, bacterial infections do not follow viral infections. Using antibiotics to treat viral infections may instead lead to an infection caused by resistant bacteria. Also, your child may develop diarrhea and other side effects. If your child develops watery diarrhea, diarrhea with blood in it, or other side effects while taking an antibiotic, call Children's Medical Group. During a common cold, it is normal for mucus from the nose to get thick and to change from clear to yellow or green. Symptoms often last for 10 days. Sinusitis is a term that means inflammation of the lining of the nose and sinuses. A virus or allergy can cause sinusitis, and in some cases, bacteria can be the cause. If your child develops bacterial sinusitis, which is very uncommon, an antibiotic may be needed. Again, our providers will determine if an antibiotic is the right medicine. Not all ear infections are treated with antibiotics. At least half of all ear infections go away without them. If your child does not have a high fever or severe ear pain, observation may be all that is needed. Because pain is often the first and most uncomfortable symptom of ear infection, other medicines may be used to ease your child's pain. Acetaminophen and ibuprofen are available over the counter and can lessen pain and discomfort. Please be sure to use the right dose for your child's age and size. In most cases, pain and fever will improve within the first 1 to 2 days. Over-the-counter cold medicines, like decongestants and antihistamines, don't help clear up ear infections and are not recommended for young children. If appropriate, our providers will prescribe antibiotics if your child has fever that is increasing, more severe ear pain, and/or infection in both eardrums. No, more than 80% of sore throats are caused by a virus. If your child has a sore throat, runny nose, and a barky cough, a virus is likely, and a test for strep is usually not needed. Antibiotics are only used to treat sore throats caused by group A strep. Infection caused by this type of bacteria is called strep throat. Strep throat generally affects school-aged children and not children younger than 3 years. Side effects can occur in 1 out of every 10 children who take antibiotics. Side effects may include rashes, allergic reactions, nausea, diarrhea, and stomach pain. Make sure our providers know if your child has had a reaction to antibiotics. Sometimes a rash will occur during the time a child is taking an antibiotic. However, not all rashes are considered allergic reactions. Call Children's Medical Group if you see a rash that looks like hives or red welts. This could be an allergic reaction. If your child has had a reaction that causes an itchy rash or hives, this will be noted in his or her medical chart. Most bacterial infections improve within 48 to 72 hours of starting an antibiotic. If your child's symptoms get worse or do not improve within 72 hours, please call us. If your child stops taking the antibiotic too soon, the infection may not be treated completely and the symptoms may start again. The repeated use and misuse of antibiotics can lead to resistant bacteria. Resistant bacteria are bacteria that are no longer killed by the antibiotics commonly used to treat bacterial infections. These resistant bacteria can also spread to other children and to adults. It is important that your child use the antibiotic that is most specific for your child's infection, rather than an antibiotic that would treat a broader range of infections. If your child develops an antibiotic-resistant infection, a special type of antibiotic may be needed. Sometimes these medicines may need to be given by IV or intravenously in a hospital. As always, if you have any questions or concerns, please don't hesitate to call our nurses at Children's Medical Group.